This conference will now be recorded.
I know it's right? Well, yeah, let's go.
Yeah, that's good. Lay down and you
Disagree back there.
About what?
This one. Because it's the wording, but I should. Best answer would have been.
It's tough. So it was like.
The wrong one or what?
Right.
It's always the rule. Look at the left hand.
I was thinking that too far.
Yeah.
I'm like, you would be able to stop it with pressure.
Yeah, that's right. That's the first thing. First. Alphabetic evacuation. First thing.
Oh, wait. That's one of the options.
Yeah.
Yeah, because isn't that additional?
What are you doing?
That's what I'm saying.
Medical evacuation.
Where's Chad?
Any other questions on this test?
Oh, yeah, I missed one.
Sorry.
6.
I know, so I heard people talk about the GCS question.
It's just, it's easy to remember what it's for and what it does. It's like forever. How many is in each one is fucking annoying.
Yeah, that's what I'm sure.
There he is. That's the guy.
There he is.
Yell at him.
Who in here drives a white car? I'm checking everybody's stuff.
Is that what you're outside doing?
Yeah, Luca's been investigating because somebody hit my freaking car.
Here or?
I don't know.
White car.
Huh?
I do not drive a white car.
Don't worry, if y'all see me out there with a tape measure, I know how many feet off the ground that was.
Yeah, dude, how come we missed that one?
Oh, goodness.
For the very first thing you do.
Also turn it.
Patient is reported as other injuries. Where's, y'all got y'all's medical sheet?
Like they're still shooting?
Or your trauma sheet?
No, I get you'll see it.
That's trauma one? I don't know why that's not freaking my thing. Listen, if I get where that question can be confusing, but ask Billy. I did it last night. So we had a young lady that had a very, very severe hemorrhage. As I was walking up to her, I was literally watching the blood pool beneath her. The very first thing I did was walk up, grab her arm as tight as I could to stop that bleed, because I basically held a manual tourniquet just above it in her forearm. I can do it to Becca too, or you can just grab their arm and hold it real tight. For the bigger guy, you're probably not gonna be able to do that. But that's what I did. We got the bleeding stopped, and then I called for air medical resources. If somebody's about to die, that's our first priority, is fix that bleed before they die, and then call for air resources.
If you get called out the laceration, you're like, I don't know. Like, that's all the only details you get, right? Laceration, I would be like, cool. I'll be there. I'm not gonna be like, send me a helicopter. Then once I realize it's arterial, then that's where it can be confusing, because maybe they meant like patient priority transport decision is after that, is maybe what they were going for in that.
It says arterial bleed.
Yeah, it's our
It's already
arterial bleed.
specified. You go.
If it's an arterial bleed, stop the bleeding first and then call for help. I mean, unless you just want to sit there and watch somebody bleed out while you call for help. Lawsuit, but.
Yeah, he's dead before the.
Yep, I digress.
All right, any other questions about the test? That was kind of a tough one. How many
Was it?
questions was it?
No, one time.
30.
30?
Oh, my
It wasn't that
phone
tough.
said it. Oh, this is chapter
No, I was like, it wasn't very long.
30. Disregard. No other questions? Awesome. Okay, so we're going over environmental emergencies. I think this one's kind of long. I think it's like 40 slides maybe. We'll get through it. If we get finished early, we're gonna pull my car out and we're gonna go.
Oh,
We're gonna pull Chaz's pickup out. and then-
Mike's got a pretty nice company vehicle out there.
Okay, perfect. We're gonna pull Mike's pickup out and go over extricating somebody on the backboard. Using the backboard. So we should get done kind of early, hopefully. All right, so objectives. I'm gonna shut these windows because the glare gets me every time. Did you get
That
it?
fly's been.
Right there.
You finally got it?
I got it. Nope.
Oh,
Dude, you're not gonna give him that book. Use this book.
That's the biggest fight I've seen in a long time.
All right, so objectives. Don't laugh. Learn signs and symptoms of heat and cold emergencies, how to treat them, learn specifics of water-related accidents and altitude sickness, and then cover the treatments, bites, stings, all that fun stuff. So, exposure to cold, this can happen in any setting. Obviously, it's not just out in the wilderness. You get like the homeless folks or somebody with their power shut off or whatever, you can deal with this anywhere. So, rural, urban, out in the middle of nowhere. So also keep in mind that people with pre-existing medical conditions and that are on certain medications are more susceptible to heat and cold injuries because their bodies have a hard time keeping up with the thermoregulation. So keep that in mind. Here's the difference of ways that we lose heat, or this also applies for like getting too hot. But sitting on something, we talked about this a little bit earlier. If you're on a cold surface, your heat's gonna get sucked out through conduction. Convection is like the wind blowing over you. That's gonna cool you down. I remember that because like the convection oven works by circulating air. So that air circulation is what keeps you up or cools you down. Radiation is just what gets pulled off of your body. And evaporation, especially when it comes to like sweating, if we sweat, that evaporates, it's going to take our body heat with it. And then you also lose heat by exhaling. Whenever you breathe out, you're losing certain amounts of heat. And there's just definition of all of them. Any questions on this? Okay. All right, so generalized hypothermia. Exposure to cold reduces body heat. Our body, if you get to a point that you cannot maintain that core temperature, you start to develop signs and symptoms of hypothermia. Some predisposing factors, if somebody's in shock, say they got in a car accident, their car rolled over in the middle of the freaking tundra, they're gonna have a harder time keeping their body heat up, right? Injuries, infection, or immobility. Diabetics, hypoglycemia. That can also be a predisposed factor, like somebody's hypoglycemic, they're out in the cold, they get altered, they don't know if they need to go inside. And then intoxication is another big one that we kind of see around here. People like to go drink and ride their side-by-sides out in the snow or their little snowmobiles and then get lost or get hurt. So these are things that kind of predispose you to being exposed to a hypothermic situation. Remember our older folks, if you've ever walked inside like your grandma's house or something, they love to keep it like 90 degrees. Because as you get older, your body does not maintain heat as well, so they have to rely on external sources of heat. So another thing to keep in mind here is like our geriatric population, because they're not very good at like thermoregulation. Sometimes they can't afford to keep the heat up in their house, so they turn it down. So they're kind of predisposed to having problems from that, because they're trying to save money, so they turn the heat down. and then they're in their house for days at a time and they're freezing there. So, yeah. Pediatrics. So pediatrics, their surface area of their skin, in comparison to an adult, they have more surface area, so they are prone to hypothermia. They also have less body fat, most pediatrics. I've seen some like 12-year-olds that look like 20-year-olds, but most pediatrics, they don't have as much body fat either, so they can't keep that heat in. And then their ability to shiver is also decreased because of their muscle mass. So, wrap your kids up in a nice warm coat. So, assessment, obviously, we know when we first get cold, there's gonna be shivering, right? Everybody in here, especially. I'm always cold. Numbness, reduced sensation, especially in extremities, and it kind of spreads up to the core, but it'll start in those fingers, nose, toes. Stiff or rigid posture, the body's trying to get them to stay warm. As you progress into the hypothermia, you're going to start seeing the drowsiness. We've all heard of like people freezing to death and they just feel like they need to take a nap before because they get so drowsy. They might get altered mental status as well. There's a common theme of people that are freezing to death kind of get crazy and then they take all their clothes off because they feel like they're hot. Loss of motor coordination, red skin that turns into pale or cyanotic skin as it progresses. So these are all different signs and symptoms you're going to see with hypothermic patients. This is something to keep in mind, even if you're not like directly in the snow, if it's not freezing cold outside. So what other kind of situations, like say the summertime, it's 100 degrees outside, you're hanging out at the Memorial and somebody jumped in the water up there. Would you be concerned about these kinds of things?
Yeah.
Those lakes up there are freezing. So, yeah. Sometimes these patients kind of sneak up on me. They're like, I don't know what's going on with them. You get to the hospital and they're hypothermic. So, different ways to keep our patients warm. You can give them, there's two kinds of warming. So there's active and there's passive. So passive rewarming is covering them up with a blanket. Active rewarming is going to be applying that external heat source. So those hot packs, the air in the back of the ambulance, turning it up as hot as you can get it. This is like a little heat burrito that you can do with patients to keep them warm. The big key takeaway here is applying the heat packs to their armpits and groin, and then up here by the neck. That's that central location, so it's going to start warming everything up. If they can tolerate warm liquids, if you're out and about and you don't think there's like something else going on where they might need surgery in the next few hours, if it's like a traumatic patient, if they're just cold and that's their only complaint, you can try giving them warm liquids to help warm them up if they can tolerate it. So if they can't tolerate it, if they're too altered to swallow, obviously don't go shoving like warm water down these people's throats. So extreme hypothermia, this is where like the oh crap sets in. So very, very like cold patients, they enter like this state of metabolism that everything slows down. So their heart rate gets really low. It can get low enough that while you're feeling it, you feel like they don't even have a pulse because 10 beats a minute for a heart rate is crazy slow, right? If they are pulseless, and remember in our CPR algorithm, if you're questioning whether you feel a pulse or not, and you're not sure, just start CPR anyways, right? Did we remember that? So start CPR with the AED. Remember, you can shock them once, but then wait to shock them again until they get warm. If they do have a pulse, you're going to treat them just as you would any other altered mental status patient. Make sure that you're checking their blood sugar. Make sure you're doing a full assessment. Why are they cold? Why is this a situation? And then remember, you're not dead until you're warm to dead. You're going to get that drilled into your head. While I was doing research on this, I don't know if it's true or not, but there was like an article about this lady that they found that she was cold, so cold that they couldn't even get IVs on her because like she was like frozen. And then she came back and lived and all that fun stuff. So you hear stories like that, That's like the extreme stories. But yes, you don't want to confirm that they're dead until they're warm and dead. It takes a long time to warm these patients up, and most of that's done in the hospital, but you can start it on your way to the hospital. All right, local cold injuries. What is this? Frostbite. What is this? Frost nip. Yep. So, early superficial frost nip, they get that white, waxy look to their skin. If you are dealing with a patient that has this or you have it yourself, don't try to like rub the area to get it warm. Why don't we do that? Yeah, there's crystals in there and you're gonna cause more damage. Same thing with frostbite. You don't wanna sit there and like try and warm that extremity up by rubbing it. Treat them, signs and symptoms. As they start to warm up those extremities, it's gonna hurt. Anyone in here has ever had cold hands and you go and stick them in warm water, it's not a pleasant feeling. So keep that in mind too. So if you're trying to rewarm, obviously you're gonna go off of your protocols. They don't recommend like active warming most of the time unless it's in your protocols because you don't want to cause more damage to that area. So don't like stick it in water unless your protocols say. But if your protocols do recommend it, they do recommend immersing that in like a lukewarm water. So 100 to 105 degrees. If anyone's ever like measured the temperature of water and felt 100 to 105, it's not very warm at all. But as you're submerging, there's the word, it was coming to me. As you're submerging that part into water, make sure you're not allowing it to touch the sides of the bin that you're using and just keep it in the water until it warms back up. Once you get it rewarmed, which I don't really know the point where you're like, yep, it's rewarmed. I don't know that point. But you're gonna dry it off gently and you're gonna wrap it with a dry sterile dressing. They also recommend transporting with the limb elevated. I'm not 100% sure why they have you do that, but that's what it says. All right, exposure to heat. It is not heat that is not needed for temperature maintenance and not lost creates hyperthermia. So there's a lot of different things that can cause hyperthermia. The one thing that we're really going to focus on today is like active people, like somebody running outside and overheating, or somebody that's like an elderly patient that's left outside for a while, that kind of thing. Remember we were talking about like brain injuries and how they can cause hyperthermia as well. So there's like lots of things that can cause hyperthermia. So there's heat cramps, muscle cramps from heat exposure. So there's a loss of electrolytes and fluid that occurs. They start to get muscle cramps. If you're at the stage of like muscle cramps, usually we recommend that if they can tolerate like drinking electrolyte drinks and start moving them to a cool place or a shaded area, you can start that. Don't have them chug ice cold water because it's gonna upset their belly. If you get to a point where it's heat exhaustion and heat stroke, they need to be transported to the hospital. So if they're like nauseous, vomiting, that's usually everywhere at work that has had protocols for this, like for standbys or whatever. If someone's showing signs of like heat cramps and we do give them an orange, and if they ate the orange and puked it up, then they were going to the hospital. So this like nausea, vomiting is kind of what like changed for us between like the muscle cramps and the exhaustion. And then if they get to the point that they're altered and their skin is like no longer producing sweat, don't purely go off of that, because we were talking about it the other day that the no sweating thing is not what you should be going by, because they still could have sweat. So this fly, you see it?
It's the same one he's been trying to
It's a
murder for the
freaking
past.
gargantuan fly. It's huge. All right, so skin signs: heat cramps, heat exhaustion, moist, pale skin. It could be cool because their body's still actively trying to cool it down. They still have like that mechanism where they're trying to compensate. you get that loss of electrolytes, that loss of salts, that loss of fluid, leading to heat cramps. And then they might experience a form of shock. So evaluate your patients, do a good assessment, look at their skin, feel it, look at their skin. Is it hot? Is it red? Is it pale? Take note of those things. So muscle cramps, weakness or exhaustion, rapid shallow breathing, a weak pulse, heavy perspiration, loss of consciousness is possible, but it's usually brief. And then the real scary one, treatment of heat exhaustion, ABCs, cool them down, move them to a cool area. You can take moist towels and put it over their cramped muscles. Pickle juice is an amazing thing if they tolerate pickle juice, mustard, you're trying to replace those electrolytes. And then there's heat stroke. This is the one that's bad. So if they get to the point of heat stroke, their temperature regulating mechanisms fail. They start to get altered mental status. They could stop sweating. Their skin's going to be hot, red. This is a bad day. What do you think your treatment for a heat stroke is going to be?
Cool them down, transport.
Yeah, cool them down. That's your number one priority, is to get them cold. They're actively losing brain cells, right? So a lot of similar signs and symptoms. This altered mental status is really what makes it your heat stroke. I was taught in my ENT class that it was the loss of sweating, but that's no longer a thing. So can lead to seizures for multiple reasons, not only because their brain is actively frying, but because they're so low on electrolytes that they can start having seizures. So you must assume heat stroke is present in a patient with signs of heat exhaustion and altered mental status. So anytime you read a question that's asking you between the two, if it's altered mental status, you should have a little light going off in your head saying that this is heat stroke. So treatment, obviously, get them cold fast. Do not, if you're in a situation where you can cool them down on scene and you have like an ice bath that you can make in a short amount of time, do that before you start transporting. You want to get them cold because every minute you wait, it's more brain cells lost and a higher chance of them dying. For infants and young children, you don't want to put them directly in an ice bath. You don't want to send them into their little systems of shock. So use lukewarm water. One thing you can do if you have like water on you or a spray bottle or something, you can spray them with water and then have a fan run over them. And how is that cold? Huh? Evaporate. Good. So this is one thing that is not in your book, but has been brought to my attention recently. This is a study that was done by Peter Antevi. We love him. If you haven't heard us talk about him yet, you definitely will. The little Antevi things that we always talk about here, this is this doctor. So they did a study where they would take patients on scene, and they actually take a body bag like you put a dead person in, and they fill it with ice water and just submerge that patient in the body bag. And they found that they have a lot higher rates of like less seizure, less mortality, less morbidity by putting the patient immediately in ice cold water as soon as the EMS crew gets on scene. So here's a quote from their study that they did, my source. Cold water immersion is considered the gold standard for rapid coolings in cases of exertional heat stroke. So exertional, think like a runner, somebody running outside, football players, those kind of things. If it's Granny that got stuck in a wheelchair in 102 degrees, don't stick Granny in the ice pack. But yeah, so this is kind of a cool thing where some places carry body bags, some places don't. If you work for a place that doesn't, maybe you should consider. We don't carry them here. So, dangers of extreme body temperatures. As the body temperature decreases, muscles shiver. We actually, once you get like further along in your EMS career, you can actually start to give medicines that stop the shivering whenever you're dealing with like extremely hypothermic patients. because allowing them to shiver is using a lot of their energy. If they're going into shock, you can stop that shivering process while you're actively cooling them or warming them up. If they're cold enough, their heart is prone to dysrhythmia. So these are the patients that you want to be careful moving if they're really cold, because just by you moving them can send them into like weak fit. Central nervous system becomes sluggish. So what kind of signs and symptoms are related to our central nervous system? Like, what are you going to see externally? Speech, altered mental status, their fine muscle movements are going to go away. So and then we're talking about the opposite. So as body temp increases, we try to sweat, we try to cool our own skin. If excessive heat builds up, the skin becomes hot, and we kind of trap all that heat inside. And that's not a good thing. So make sure you treat them opposite, right? So if someone's real cold, you're gonna get your hot packs out. If someone's real hot, you're gonna get your ice packs out, right? Monitor your ABCs. Treat the signs and symptoms. That's the biggest thing for these. If they're not breathing, breathe for them. If they're hypoxic, treat the hypoxia, okay? All right, so water-related emergencies. We're gonna review some things that are kind of related to water-related emergencies. The biggest one that I put on here that I was like, that's a water-related emergency, or what I thought you guys might, is the signs of a heart attack. So what kind of situation might you be in that's related to water that the patient's like, I have chest pain, and you put them on the toilet leading there, like, oh yep, there's a heart attack, but it's from the water. Anyone know? Not quite. No? Okay, we'll get to it. I was just curious if anyone was stumped by that. Obviously injuries to head and neck, huh? Not quite.
Breathe less.
It does. I like where you're going. It's kind of related. Injuries to head and neck, we talk about that all the time. Diving into shallow end of pools. That's a big thing, right? Internal injuries, hypothermia, like we talked about, the water can be cooler. Substance abuse has somewhat to do with water-related emergencies. Drowning, we're going to talk about drowning. We're going to talk about the big thing that they started going off of on the news media about dry drowning. We'll talk about that. Another thing that isn't in your slideshow, but I do want to talk about is like patients with autism, like low functioning autism. For some reason, statistically, they're drawn to water. So whenever you're dealing with those kind of patients, a lot of times when they run off, they get out of mom's sight for 2 seconds, they find them in the water. So that's another thing to look out for. So, according to the World Health Organization, drowning is a process of experiencing respiratory impairment from submersion or immersion in liquid. So what are signs and symptoms of respiratory impairment? Okay, what kind of signs and symptoms are you going to see with water in the lungs? Gurgling, coughing, shortness of breath, rapid respiratory rate. Okay, so keep that in mind. So usually begins if someone's struggling to keep afloat. There's like a process that goes down here. They start to submerge. They take one more deep breath because they're trying to get that, they're freaking out. They're trying to get that last breath of oxygen in, and then that water enters the airway. So coughing, swallowing more water, it's a whole process, right? So they're trying to stay afloat. They're trying to take one good breath in. They're under the water. They're freaking out. They're sucking in the water. I told you all the gives. So by the water hitting in their airway, their vocal cords will actually spasm. So they get this lowering spasm that occurs during drownings. And if you go on a drowning patient, that is something to keep in the back of your mind. Whenever they get pulled out of the water and you're trying to bag them, 9 times out of 10, they're going to be difficult to bag because of that laryngospasm. They're not letting that air get past their vocal cords. So does anybody remember how to break a laryngospasm? We talked about it in our CPR class.
I know it was more forceful to do that before you start your compression.
Yeah. So your most important intervention in those first few steps out of pulling a drowning patient out is forceful ventilations, because you're that lung spasm's freaking out, and you're trying to break it so you can actually ventilate your patient. The unconsciousness results from hypoxia in a drowning situation. And then this is another maneuver. It'll come to me the name of it. Lcems maneuver. There it is. I knew I was going through the files here. Lcems maneuver. So this pressure point right here, the same pressure point that you use to do jaw thrust maneuver, can also break a laryngospasm. So the pressure point, you push hard enough, that laryngospasm breaks, and then you can bag them easier. Keep in mind that if they have inhaled a bunch of water, their lungs are now going to be full of fluid. Okay? Drowning patients have achy airways. It's going to be frothy, it's going to be pouring out, and it's hard to manage. So get your BDM ready, get your suction ready, get your OPAs, your NPAs ready. Their airways are hard. So I did want to touch on this dry drowning thing because it seemed to be a media frenzy like a couple years ago. And they had a kid that was like swimming and not even swimming, he was playing in water that was like a foot deep. And like a week and a half later, he died. And the news media was like, oh, he's dry drowning. He got water in his lungs. And the drowning didn't occur till a week later. So they've done a bunch of studies on it. He actually died from myocarditis and not even anything to do with the drowning. So for dry drowning, drowning in itself, like we talked about the World Health Organization, respiratory impairment from submersion or immersion in liquid. What the heck just happened?
I think it's your fly, buddy.
Did he land on it?
It's been landing on
That, oh. All right, so the effects of drowning present rapidly, not weeks later, and deterioration occurs within hours, not days to weeks. I need my.
Get him, Chaz.
Get him. Sick him. I'm already taking my shoe off and telling this guy.
He'll be back.
I see him. Feel his air when he flies by.
It's like he knows he's annoying.
Nice.
Oh,
There you go.
oh, you
Yeah.
got him.
You got him.
It's in your ear.
360 nose clip.
All right, John Cena.
Good job. Thank you. Okay.
Quickest hat in the South. I guess West.
West, yeah. So if you get a call for a parent that is concerned about a dry drowning, and it's been weeks since their kid has been swimming, keep in mind that yes, they may have inhaled some fluid from the water that can cause like a pneumonia problem, but it's not a dry drown. That is not like a thing. So just wanted to cover that. So this is like the best picture I could find of the kind of airway you're going to encounter in drowning. If you watch videos of like simulations of drowning, like airway management in a drowning patient, they're pretty true to, if they get like frothy, it'll just start bubbling out of the tube. It's a nightmare. So do not delay transport. If it is a drowning victim and they need an advanced airway, call for ALS. We talked about ventilating more forcefully. Your first step should be rescue ventilations. Even if it is a cardiac arrest, you want to do 2 good forceful breaths and then start your cardiac arrest algorithm. All right, spinal injuries in the water that come from diving or anything. Assume a unconscious patient or patient with head injuries has neck and spinal injuries as well. We went over this a little bit on Tuesday. So why is your C-spine so susceptible to injury? Yeah, it doesn't have support, right? So resuscitation, obviously, life before limb. So if somebody is unconscious, you're going to start your rescue breathing or CPR before you worry about the C-spine. You're still going to consider it for your national register sheets. You're going to consider C-spine, but if they're dead, you're going to fix that first, right? Diving accidents, like I said, that's going to be your #1 test question when it comes to spinal injury. So can involve other parts of the body, but if they're pulled out of the water after diving in and they're unconscious, you should suspect spinal injury. Scuba diving accidents, We run a lot of these a year out here, obviously, with all the water that we have around. We have just gave it like I'm just kidding.
I wanna know what they do.
We don't actually.
Maybe somebody scuba dive in Miller's Pit.
Yeah, no, you don't see this a lot around here. But it is still some stuff to know. Usually if you work in a place that runs a lot of these, you're gonna get trained on them pretty in detail. So one scuba diving accident that you wanna be on high alert for if you're dealing with this is an arterial gas embolism. So these gas bubbles enter the bloodstream. It can cause pain. I think the signs and symptoms are here. So here's all your signs and symptoms. This is that chest pain, myocardial infarction. So that air bubble gets into their heart, causes heart attack symptoms. They can have like a heart attack on a 12 lead, but it is an embolism. So this is what we're trying to avoid too whenever it comes to like neck injuries. We're trying to avoid getting that air inside the vessels. So different things can cause it: inadequate training, equipment failure, underwater emergency, or trying to conserve air. Stroke-like symptoms, that little bubble, think of it like it's blocking wherever that blood needs to go. So you can get the stroke-like symptoms, you can get the heart attack symptoms. Apparently strokes on here twice. Respiratory arrest, cardiac arrest, all that fun stuff.
Wait, so does the air bubble, does it stay there?
Yeah, it can, and it blocks whatever past that air bubble, just stops that blood flow. So it acts kind of like a thrombus would, or like infarct would. It acts like that because it's stopping the blood flow from this area to this area. So you're going to get all these signs and symptoms. Decompression sickness. So this is also like if you think of like the bends, that kind of stuff. You ever heard that term? That's related to decompression sickness. So whenever somebody dives, they have to come up in increments whenever they're coming up from deep depths. If they don't do that and let their body adjust, they start to get these signs and symptoms. So they surface too quick. It can take a little bit to appear, like 1 to 48 hours. The most common one is the pain in the joints. They start to get like really bad pains, like in their elbows and knees. But it can progress. It can be worse than that. But the most common is the pain in the joints. So itchy blotches or mottling of the skin, numbness or paralysis. They can have, like, think of your hollow organs. It can affect your hollow organs as well. So yeah. So your treatment, ABCs, treat the signs and symptoms. If they're hypoxic, give them oxygen. If they're altered, treat them like an altered mental status patient. I was taught to keep them on their left side because if it is an embolism, it keeps that bubble on the like right atrial part of their heart and stops it from going into their lungs somehow. New studies show it doesn't matter. You can keep them supine, left or right side. Okay. And then marine life. So this is another thing that might come if you work next to like a aquarium. There's a word. Aquarium or like in the ocean, marine life, obviously. So this can come from a variety of ways. They do throw like eating improperly prepared food in here. One is like pufferfish. People eat pufferfish. If you eat the intestines of a pufferfish, very toxic. You can eat the skin apparently. Another one is like these stingray tails, even in your aquariums. So these stingrays will just lose their little spike things. And they'll just be laying around the aquarium, so they have divers that go in and like clean the area, and sometimes they'll get hit with one of those or like poked. We had a guy that came and talked to us in our paramedic class that cleaned the aquarium, and he ran into this a few times because like the freshwater, saltwater stuff, if they're no longer submerged in water, either way, I know this says freshwater, use saltwater, either way. He said whenever you get one of those barbs in your skin, the only thing that really takes the pain away is like just being under really hot water constantly. So keep that in mind. If it's still in there, obviously you're going to splint whatever area it's in. You're going to transport them to get it taken out. Another thing is like jellyfish stings, salt water,
Well,
vinegar,
this is a jellyfish.
pee on.
Right on
Pee on it. Does anybody know what kind of jellyfish this is? Yeah, it's a jellyfish. Very venomous.
We stand on business for Steve Irwin.
Yeah.
Fight for stingrays.
Yeah.
Has anybody ever been stung by a jellyfish? Crap sucks. I grew up near the ocean. It happens, it sucks.
You don't actually feel it.
No, I mean, I didn't let anybody pee on me. I just, so I don't know how you actually get away from it. It just sucked for quite a few hours. I had like, they wrapped around me. I had like all the little wrap marks around my stomach, and apparently I got to a school of them. Yeah, it sucked.
I think, whenever my brother's fiance got stung by one in Jamaica, they had like a solution that they poured on.
Yeah, ammonia solution.
Yeah, something like that.
I didn't go
So what they had for my cousin, they had lifeguard people park on his arm. He's old.
All right, so if you're gonna do water rescues, reach, throw, row, and go. I think your book says reach, throw, tow, row, and go. Reach, throw, / row. Yeah, so first step, try to reach them with something. If you can't reach them with something, you're gonna throw something that is floating, that is a floating object. You can row to them. Your last resort should be to go to the patient. Not recommended unless you're trained in water rescue. So drowning people tend to take you down with them because they're flailing and freaking out and you get sucker punched or they grab you and pull you down with them. So try to avoid.
You know how to stop that?
Choke them in.
No. Literally just get behind them, hit them with the old rear naked choke until they go to sleep and take them to the edge. That's what I had a scoop or a lifeguard tell me that one day. Yeah.
Choke them out.
All right, see, all right.
Mhm.
Mike come in here because he heard choke it out.
That
He's
is your
like,
Mike Lake wants to see your rear naked choke by me.
Look at his landing.
All right, ice rescue, number one rule, protect yourself. So don't go walking out onto the ice, please. Same kind of idea, reach, throw, row and go kind of thing. You can row out there. Don't work alone. Don't walk onto the ice. Poor little puppy.
this happened to our dog last year.
We're trying to figure out what someone that drives out on the lake and on the fish.
Yeah.
Yeah, this happened to our dog last year. She jumped on a little batch of ice up on one of the lakes in Memorial and fell through.
Yeah. And then treat for hypothermia, obviously, cold water, cold patient, transport. All right, high altitude emergencies, we don't really have to worry about it so much around here. What is one big city that you would have to worry about this? Denver? Yeah.
I think Utah too, isn't it? How high is the mountains around Salt Lake? 13? You probably run into it around there too.
Yeah.
Probably Great Basin, Wheeler Peak,
Yeah.
stuff like that.
Yeah.
Nothing around here though.
Not in Lander County. All right, so high altitude emergencies, there's less oxygen in a higher altitude. Decreased air pressure, and the people that go up there need to adjust to the high altitude. So if you ever watch like a documentary on Army, Mount Everest, they all hang out at base camp for however long to adjust, and then they start climbing up. So there's acute mountain sickness, which is a less serious case of like the three main cases that we're going to cover. So they have a hard time adjusting. In the mild cases, they sometimes just need to rest, rehydrate, get acclimated to where they are, and then they can keep going. More severe cases, they need oxygen, they need to descend, and they need treatment. So. One big one that you are going to get tested on, high altitude cerebral edema. So what do you think cerebral edema is? Swelling in the brain. Yep. Cerebral, meaning brain, edema, fluid on the brain. So this is the most serious form of acute mountain sickness. So they're very serious about putting this in here, even though both of them can kill you. the next two slides. They can both kill you, but they're like, this is the most serious. They're both unkillable if they're not treated. So signs and symptoms, they're getting fluid on their brain. So neurological symptoms, right? So headache, loss of balance and coordination, you lose that fine motor movement, severe fatigue, seizures, all that fun stuff. Your treatment, arrange for immediate descent. As you start coming down, they should start getting better. Treat their hypoxia, give them oxygen. If they're too altered, obviously you might need a bag for them. If they start having seizures, consider ALS. We treat them with steroids, so your best bet is just to start moving downhill. And then high altitude pulmonary edema, known as HAPE. So pulmonary edema, same kind of thing. They're too high of an altitude. They didn't acclimate. They start getting fluid in their lungs. They can start coughing up like a frothy, like that sort of that pulmonary edema that we talk about in CHF patients. Same kind of idea. They can start coughing it up. It can be pink, it can be frothy. It looks like a strawberry milkshake or a vanilla milkshake. What do you think the treatment for this is?
Oxygen.
Oxygen and what?
Take it back down.
Take them back down. Yep. Arrange for immediate descent, oxygen, and transport. Minimize physical activity. You don't want to move around too much, exerting themselves. All right, bites and stings. Little B. So, certain animals and plants produce toxins that are harmful to us. All spiders are venomous. Whether they're venomous towards humans or not is another thing. And whether they can bite us or not is another thing.
We haven't learned about it.
What's a little spider do?
Apparently heat can occur as low as 8,200 feet.
That's fine.
So,
I don't know.
I'm low.
Really? Well, daddy long ways?
The bubble.
I
You
like
guys been to the
daddy
bubble?
long
I like Sonar.
ways.
Those are from, yeah, it's called the weather bubble.
Oh, yeah, we drove up to it.
Yeah.
Oh, okay. So, difference between poisonous and venomous, we're gonna talk about that. If it's poisonous, it's because you bit it and it poisoned you. If it's venomous, it bit you and now you're poisoned, okay? Poisonous, venomous, that's the difference. So commonly toxic, the brown recluse spider, I don't think they're around, are they
Yeah.
around here?
Yeah, I got bit by one.
Ooh,
That sucked.
they
It
get
was
like this
It
very.
just kept spreading and it was all fucking, they had to like.
Lancet. Yeah, so they get like this very distinct bite where it starts out small and then like bubbles out and that skin breaks and can lead to infections and all sorts of stuff. So
They decay out and get giant holes.
they have this very distinctive little violin on their back. The black widow. So usually if you see, I had a lot of questions in my NREMT that had to do with black widow spider bite. And it was somebody working on, like, in the log, like they were logging, and then started complaining of really bad abdominal pain. And it was the black widow spider, because I Googled it. That was like one of the questions I remembered. I knew I got it wrong on the NREMT, but that's what I had to do with. So abdominal pain, possibility of spider bite, black widow spider, those should be good. And then this scorpion. I don't think that's around here. Maybe it is. I hope
I
not.
have scorpions.
I'm moving.
We have scorpions.
These kind of scorpions? Ooh, because this is like the only kind native to the US that's like toxic to humans. So,
Bad doing so bad.
Yeah, they're more south, but.
We had a pet at our shop and process of one of those. We put a black widow in that. They fought.
Make a fight, yeah. They do a lot of flying.
we gotta go.
It seems to be like a lot of movement.
We gotta move out of the state. All right, so
There's
signs
more.
and symptoms of an insect sting. You guys have probably all been bit by an insect. I can't say that word today. So, in worst cases, altered mental status. The biggest takeaway here is if they're allergic, anaphylaxis. So, numbness of the limbs, burning sensation, stinging sensation, pain, swelling, blistering, chills, fever. Treatment for it, if it is an anaphylaxis situation, you want to remove the stinger as soon as you can. Obviously, you're gonna treat the live threats first, but try to remove the stinger. It stays in there. What do we remove the stinger with? Credit card. Good job. All right, call medical direction if necessary. If you can get a description of whatever bit them or stung them, obviously if they got stung by a bee, they're going to say you don't have to bring the bee with you, but if it's like something.
This is the big question.
Yeah, this is the bee in question. Remember to remove jewelry from the affected limb. Why do we do that?
Swelling.
Yeah, you don't want it to swell up around it. And then try to keep the limb immobilized the best you can. Snake bites.
Just a little snake.
So require special care but are not usually life threatening. We have certain snakes around here that are life threatening. Yeah, all that. So if you know where your anti-venom is, which I know Elko has it for rattlesnakes.
We carry it here.
We carry
We
it
found
here.
out.
But sometimes you can take a whole bunch. So sometimes you have to make stops at every way. Keep patient calm and at
Are
rest.
you raising your hand? Oh.
Doesn't anti-venom have more side effects than actual snake venom?
You know, I don't know, but I do know that it is extremely expensive. And apparently that's the reason why they only carry like one vial at a hospital. Is because it's like some stupid price to get a single vial of it.
I thought half the time they just maybe venom went through, isn't it? Yeah. And then they administered anti-venom.
Yeah, I guess it depends on the kind of reaction. If they're not in an immediately life-threatening reaction, maybe they'll wait. But I'm not a super versed.
I would make
3
sense.
people that got bit, and they're gonna be like, all right, you get to die.
Like, I still have pain, I'm not dying. I'm gonna need $3 billion. Yeah, I don't know. That's for sure.
Yeah, I'll
Especially
ask.
living around here. Yeah, so the most effective technique is to slow venom spread. They kind of go back and forth. I distinctly remember being taught not to put a tourniquet on this. Apparently now they're teaching you to put tourniquets on it. So,
How would you know how far it's spread?
I mean, you can mark like the redness, but I don't know. I've also been taught that if you get like bit by a snake, you should immobilize your limb like in a straight, because you don't, if it's bent, you like don't want the venom to stay in the bent joint. So like you immobilize the arm straight. I could be wrong. Have you been taught that? No? Okay, it might be bullcrap, but, like I said, these folks back here know more about this stuff than I ever would. All right, so venomous snakes native to the U.S. We have
that's a
coral
small
snakes and the note ropes of the U.S. So there's a little saying, what is it? If red touches yellow, you're a dead fellow. So coral snakes and these king snakes look similar. Water moccasins, ooh, rattlesnakes, we all know what that looks like. And copperheads, they get like these Hershey Kiss shapes on the side of them. Apparently they smell like cucumbers. I've never actually smelled a copperhead.
Who's going around?
Snake. And who the hell's over there like?
No, like it's a very distinctive smell. You'll smell it. It's like when you're walking through the woods, you'll know. Like it's kind of weird. The first time you smell it, copperheads were really big in Georgia, and so are water moccasins, rattlesnakes. We have like Georgia has like the second widest arrangement of snakes in the U.S. and you'll know. It's
Like,
weird.
You don't have to be close to them.
Yeah, you ain't gotta walk up and sniff his butt. You'll know it.
How do you get in your face? I'm smelling copperhead. All right, so treatment of snake bite, signs and symptoms, if there's a noticeable bite on the skin, pain and swelling in the area. If they do have like some redness starting to develop, take your mark around it, so if it spreads, you can kind of see how quickly it is, or the hospital can. Progressive weakness, vision problems, drowsiness, seizures. Call medical direction if it's in your protocols. Try to get a description or a picture of the snake. Keep patient calm. Again, remove jewelry, immobilize bitten extremities, and transport the patient. So here's some examples of snake bites. You can see where they marked like the redness and the swelling at each stage.
Kicking at the snake.
Yeah. Hey, snake. And,
This is probably the most common snake bite that you'll see is in like a foot or lower extremity. You're hiking through the woods, you step a little bit close to the note rope, and he just reaches up and pops you real quick. I've had him like strike the side of a four wheeler I was riding. I've been bit by snakes, like not venomous snakes. I've been bit by a couple of different like rat snakes and king snakes and stuff. I mean, I was trying to grab those, but
And smell it.
yeah, I was like, let me smell your butt. But most commonly, you'll see those lower extremity bites. If you see somebody that has an upper extremity bite, like a rattlesnake or a copperhead, they're doing something they ain't business.
Like that guy that like his front back or something.
Yeah,
yeah, the
yeah.
dude
He was down there trying to freaking. He'd be like, "Did you drink my Mountain Dew? Look at. Did you drink my Mountain Dew?" Ah.
Yeah, that sucks. All right. What kind of questions do you guys have about this?
Most snake bites don't hurt though, like the rat snakes and ball pythons and all that.
What's crazy classified? Yeah, that was one I seen on test. Sea urchin.
Yeah, don't touch them.
Yeah, don't touch them.
They're dicks.
I think the question I had like, what kind of
All right.
what is this classified as a bite or
Austin, if y'all are at the station with Kim, y'all can do whatever Kim wants to do. We're gonna take the students up here out and show them extrication techniques out of a vehicle onto a backboard. Just try to waste a little bit of time. But other than that, I think we're good.
Good to go. They said copy.
If we
All right,
want to real quick, clean up this room, and then we'll make our way outside.
Thank you guys.